I can start now. Yeah. Okay. Hello, good afternoon, ladies and gentlemen. I'm Dr. Grace Wu, Senior Consultant in Children Eye Diseases, working at KKH and National Eye Center. Today, I'm going to cover two topics, lazy eyes and myopia. Yeah. So what is lazy eye? Okay. Lazy, basically the word lazy means you have the ability to do things, but there is a lack of willingness and making an effort to perform the task. So this is exactly what describes the condition of amblyopia or lazy eye. In medical terms, lazy eye is amblyopia. So the eye is normal, but the brain is not willing to use it. This happens when there is a disruption of a normal visual development in early childhood, despite the eye being later on become normal. So lazy eye happens when one eye experiences a blur image and the other eye experiences a normal image, but the brain only processes the normal image on the normal eye and ignored the weaker eye. Okay, now, so as it happens, as a result, the brain, which is used for seeing, which is at the back of the brain, what we call the visual cortex, is not developing properly. And this development complete by the age of 7 and 8. So mind you, sight is not just a sight, it's not just projecting a good image on the eye. The image needs to be processed by the brain and interpreted by the brain. And an analogy will be like your webcam, your camera, which is like your eye, connected to the computer. The computer is like your brain. Just having a good image in the camera is not good enough. The image needs to be sent to the computer, which is processed and interpreted. So who is lazy here? The brain or the eye? It is the brain. And this is proven by the study by 2 Nobel Prize winners, Wiesel and David Hugo. They did this work in baby kitten. So what they do is they patch one eye of the baby kitten and later on dissect the brains to look at the visual cortex development. The visual cortex is the area in the brain used to see fine details. And they find that when the kitten have their eyes patched, the ocular dominance columns of the visual cortex are not fully developed. And hence later on, perhaps the kitten become a lot older, become a cat. When they actually unpatch the eye, this is not going to change this development of the brain. So they also done experiment on rhesus monkey and find that this visual development, this process actually complete by the age of 7 and 8. Therefore, if we want to interfere lazy eye, we have to do it very early, because between the age 0 to 3 or age 0 to 3 months, that is a critical period of development of these cells. And between age 0 and 3, those are sensitive period. Yeah. So what causes the lazy eye? Okay. So basically anything that obstruct the visual axis or the pupils or preventing a sharp image form on the retina will cause lazy eye. The brain will simply give up. Okay. This is natural, isn't it? The brain will always try to use a better eye, take the easy way out. And as a result, the brain fails to develop those little columns of cells in the visual cortex for fine vision. So something like if a child born with a droopy eyelid, or if there is a cataract, or if for whatever reason, the long-sightedness, short-sightedness, and in Singapore, one of the most important reasons for amblyopia is astigmatism, which is not corrected, then the brain will say, hey, You know, I don't need to develop all these cells to see. The brain literally give up. And lazy eye is related to squint, strabismus. The eye which is center or fixated is a strong eye. The eye that drift out or drift away is the eye which is lazy, that the brain ignore. So what are the treatment for that? Okay, suppose if you don't have a perfect image formed on the retina, you use glasses to correct. The brings a perfect sharp image on the retina again, so the brain will recognize, hey, you know, I can see better than that. Let's develop more cells as the visual cortex. And patching is also a very good treatment, very effective, cheap treatment. Basically, when you patch the eye, you are forcing the bad eye to use. You are eliminating the competition from the good eye. And the brain has no choice but to develop those little columns cells or for fine vision. Okay, now I'm moving on very quickly to myopia, short-sightedness, which is a very hot topic and a very common problem in Singapore. What is myopia or short-sightedness? Myopia is a cause due to an elongation of the eyeball, and it can progress rapidly during primary school years at a rate of 1 to 1.5 diopter per year, or in layman terms, 100 to 150 degree per year. The progression typically slows down during the teenage years and stabilizes in early adulthood. In Singapore, 10% of the kindergarten children have myopia, 60% in primary 6, 80% at the age of 18 years, which is not very good news, isn't it? Yeah. Now, some information about the myopia in Singapore. Now, the more myopic you are, the younger you are to acquire myopia, the more likely you will get high myopia in future. The rate of increase of myopia is about 100 to 120 degree in the age group, about 6 to 8 year olds, and 50 to 70 degree in the age group 8 to 11 year old. So what happened over the years in Singapore? You will see that the myopia, the prevalence of myopia are creeping up. And what are the risk factors of myopia? Well, there's genetics, but environmental play a very important role too. In genetics, if you have one parent who have myopia, you double the chance of getting myopia. If you have 2 parents, it's 8 times more. And how severe your myopia is also related to your parents as well. Now, environmental factors cannot be ignored. In fact, it plays quite an important part, particularly outdoor activities. And how to prevent myopia? Of course, you need to have more outdoor activities, spend more time in natural sunlight. This is proven by the Sydney Eye study. They are looking at children, Chinese children in Singapore and Sydney. So there is no racial difference, okay? Both are Chinese children in 2 different countries. And of course, you know that there are more myopia in Singapore than in Sydney. Now, the children in Singapore and the children in Sydney, they're both Chinese, they have the same diet. They read similar number of books per week, but what is different is the number of hours they spend outdoors. In Sydney, the children spend a significant higher number of hours outdoors than in Singapore. Now, what about our reading or study habits? Near work related parameters and myopia in Chinese children has been studied in China. They find that if you read continuously more than 45 minutes or tilting the head very, very close to the paper, or the reading distance less than 20 cm, or watching TV less than 3 meters, that will increase your risk of myopia progression. And, you know, unfortunately, this is our nowadays lifestyle now. Spending a lot of time on the screen. Even babies are introduced to laptop, iPhone at a very early age. You have to open your computer or get an iPhone to feed your baby. Family members not talking. They are all on some digital devices. I think we should improve on this. Now, what are the strategy on myopia prevention and control? I've talked about all the lifestyle. It's not only prevention, it's also control the progression. But unfortunately, if you do develop myopia, there are some strategy to control the progression. The first strategy I'm going to talk about is atropine drops. Now, atropine has been around for a long time. It has very good evidence in controlling myopia and has been tested and been studied. In the old days, in the 1990s, we used 1%, and it brings a lot of side effects such as glaring and blurring. But now we are using a lower dose, a much lower dose, 0.01%, which we find that it slowed down myopia progression by 50 to 60% in a 2-year study with no short-term side effect. But if you stop the drops abruptly, it can rebound. So the advantage of atropine is it is well studied, has good evidence for it, and is cheap. Now, another technology which is becoming quite popular and is very new is using myopia control spectacle lens. Okay, we call it DIMS and HEL technology. DIMS is defocus incorporated multiple segments. HEL is highly aspirate lenses. And what does it basically do is this optical system is tricking the eyes so that the body believe or the brain believe that they are in the outdoors. And it causes this hyperopic blur. Recent studies have shown that the peripheral of the retina is also responsible for the progression of myopia, or the progression of myopia as well. Now, these lenses can be used in combination with eye drops. The method is safe, but these lenses are not cheap. The spectacle lenses, quite expensive. Now, the next one I'm going to talk about is OK lens, or the ortho keratology. This actually prescribed in the high street optometrist. It reduces the progression of myopia by 50% in a 2-year study. It will be best for children who are older than 8 or 9 years old, who are mature, with a degree of less than 600 and an astigmatism in less than 150. However, the effect of these lenses tend to wane off over time, and we do need some long-term results. It will certainly rebound, the myopia will rebound, and it is stopped suddenly. And as you know, contact lens is associated with risk of infections, causing corneal ulcer and sometimes ocular surface problem. It may not be a corneal ulcer or infection, it may be simply a scratch on the cornea or causing some dry eyes. The last but not least is quite a new development. Very new, is multifocal soft contact lenses. Again, it has the risk of infection. The way how it works is also to trick the eye to believe that we are in outdoors, and it is more for mature children. Now, I'm not talking about all the different methods of controlling myopia here. I am only mentioning the ones which has moderate to good evidence of certainty published in the literature. And the last but not least, this is my final words, prevention is always better than treatment. Start young, outdoor activities 1 to 2 hours a day, and try to do less accommodative work as possible. Good lighting for reading, take some breaks in between close work. And sleep is also important too. There is some evidence that the lack of sleep is also associated with progression of myopia. And thank you very much. I'm happy to take any questions. And so Q&A, isn't it? Yeah. Let's start from the first. What type of lubricants are good for dry eyes? Amy, this is, am I looking at the correct question? No. No. What are you Okay, what about long-sighted? Which one is atropine eye drops effective in controlling myopia progression in adults over the age 50? Yeah, thank you for asking this question. I think the mechanism of myopia progression in adults over the age 50 is not to do with the elongation of the length of the eyeball. It's probably to do with early formation of cataract. So I would say no, the atropine eye drops has no effect on that. How many degrees are considered high myopia? Now, in the current literature is more than 600 degree or 6 diopter. There is another question. At what age should a child start to wear glasses, and from what degree? I will say correct any degree if a child is found to be myopia. There is a couple of studies show that if the child myopia is not corrected or undercorrected, it can actually lead to or hasten the progression of myopia. So the next question, is there any remedy of lazy eye for elderly? Well, it is very, very difficult to treat lazy eye when you become a mature adult. There are some program is called very high intensive visual stimulation, but the amount of time and energy dedicated to it is very high. I would say it is quite difficult. Can I move to the next question? How effective are the myopia control lens? Now, are you talking about the myopia control spectacle lens with the DIMS technology? And the HEL technology is about 50 to 60% effective, but it is not recommended to be used in very young children because these lenses sometimes may distort the image. But however, you know, if the child is 8 or 9, it's perfectly fine. The next question is from one of our audience. A child with myopia needs to wear glasses for whole life. Can the degree reduce when they get older? All right, that's a very good question. A child with myopia, yes, when the eyeball is elongated, it is elongated. You cannot squash it back. But of course, you can wear contact lenses and do LASIK to correct it. When will the degree reduce when they are older? Yes and no. If it ever reduces a little bit, it's because you are getting 老花 or presbyopia. The length of the eyeball remains unchanged. So the question, the answer to that is, it appears to be lower when you get older, but it's not. But it's actually not. It's because of your presbyopia kick in. So another question, my child started wearing spectacles at a very young age, not due to myopia, but astigmatism. Any advice to assist in the correction of this condition? Now, the good news about astigmatism is, unlike myopia, it doesn't progress. Many studies have shown that they tend to stay pretty similar or the same throughout life. The only way to correct astigmatism is either with the toric contact lens, where the contact lens is worn in a special meridian, or you go for a LASIK or glasses in future, go for LASIK surgery in future. Amy, are there any more questions? Is it safe to use? How old can a child be tested for myopia? Oh, they can be at any age very young, but if they are at a very young age, between the age 6 or 7, you need to come to the hospital to have it tested. We will use eye drops to make the pupil bigger so that our specialist pediatric optometrist can use a technique called retinoscopy to find out the actual degree. This technique does not rely on the subjective response of the child. For 6-year-old, how to reduce myopia? He is wearing glasses. Okay, as I say in my last 5 slides, which describe about the moderate to good evidence of myopia control, atropine eye drops has got good evidence in controlling the progression of myopia. And then the other methods are the DIMS technology, myopia control spectacle lens, but they are quite expensive. OK lens is also offered in the high street optometry shop, but it causes, it is associated with an increased risk of corneal ulcer and infections. And it's for older children. So I would say 6-year-old, your best bet is atropine eye drops, or the myopia control spectacle lens, or a combination of both, because all these lenses can be used in combination with eye drops as well. Can we take one final question, Amy? Do we have time? Okay. My son is diagnosed with long-sightedness when he was 7-year-old. However, he told us he seldom needed his glasses. Is there a chance this condition has improved? Yes, certainly. Certainly. Okay. We find that with long-sightedness, the eye is shorter. And as the body is growing, the eyes become longer. So if, say, your son is only like 100 or 200 degree of long-sightedness, very likely by the age of 16, this will probably resolve. He does not need glasses. But if he starts off with 500 or 600, please be realistic. You know, this is not going to drop down from 700 to 0. It might drop down by 100 or 150. So he will still need glasses in future. What are the possible side effects of low-dose atropine eye drops? Is there any long-term impact that could be of concern? Okay, I can tell you there is no short-term side effects. The long-term side effects basically are theoretical. As you use atropine, 0.01%, it hardly changes the pupil size, but it does allow more light into the eye. So theoretically, people are questioning, would it increase the risk of onset of cataract or the age of onset of cataract? Or would it affect the accommodation, or would it affect the macula? But from the experience, this is a very safe drops, especially we are using the very lowest dose, 0.01%. Amy, is there time for one more question? Yeah. Administering of atropine drops is usually reduced or stopped at the age of 12. Why is it not advisable to use atropine drops for long term? Okay, that's also a good question. A lot of parents ask me about that. Well, because after the age of 12, after a child reaches puberty, the myopia progression is very little, very, very little. Mind you, all these eye drops, spectacle lens, contact lens, we are treating the progression. We are not treating the myopia. You know, the eyeball is that length, You're not going to squash it back. And therefore, when the myopia is stabilized, usually when they reach puberty, there is nothing to treat. And, you know, that is a good thing. All right. Now, thank you very much for everybody's interest. And if you have any query or any concern about your child, SNEC, KKH are very happy to take in the cases. Thank you. Have a nice day.